Lesson 3 in Module 3, handling sick days and stress. So what is the impact of illness during pregnancy? So again, circling back to hormones, because of what is the impact of illness during pregnancy? Again, because of hormones, we're going to see heightened or intensified reactions to otherwise, normal stresses. So our insulin needs may increase 25 to 50% during illness in pregnancy versus a 10 to 25% increase outside of pregnancy. So what this means is that if on a sick day when you were not pregnant, you ran a temp basal or you calculated your long-acting insulin to be 25% more than a typical day, you might need 50% in order to keep your blood sugars in the same range with otherwise, similar food activity, things like that. Ketone production is accelerated, and this means that you're more likely to have ketones at a lower blood glucose. So this fat metabolism that is happening during pregnancy is the culprit here. And I think that this can be tricky, but the key takeaway there is that you don't have to panic if you're having a blood sugar that's at 150. That is not the goal of this information. What you want to recognize is that if you have a sustained blood sugar, say your blood sugar has been 160 for 4 hours, that might be a scenario where you begin developing ketones, whereas outside of pregnancy, you may have needed to be, well above 200 to develop ketones with a sustained blood sugar like that. So this ketone production can feel overwhelming, but I think number one, have ketone strips handy. Don't be afraid to use them. Don't be embarrassed about if you need to check them or something like that, because it's a data point. It's information that helps you understand what's happening. And know that if you, say you woke up at 6 a.m. and your blood sugar was 160 and you have CGM data that shows you that you've been climbing since midnight and you've been at 160 for the last 3 to 4 hours. Number one, it'd be a good time to check your ketones, and it's good information for how you're going to treat that high blood sugar. You're going to be more aggressive. You're going to switch to, giving an injection if you're using a pump. You're going to, replenish your hydration more quickly. You're going to focus on that. And you'll be in contact most likely with your provider just to let them know and keep that communication open. Okay, dehydration. It occurs faster during pregnancy because we have an increased blood volume and our metabolic demands are different. Some ketone monitoring criteria. Absolutely, if your blood sugar is above 250, check your ketones. Or if you are having a difficult time adjusting your blood sugar, if your correction factor, which is usually working for you, is not working, check your ketones. If it's sustained, where it's been above 150 to 160 for a duration of time, especially I would say in that 3 to 4 hour range, and there's not an odd, like you didn't have pasta but your blood sugars aren't responding to your post-meal exercise, your insulin, your correction doses, check your ketones. If you're vomiting, especially if that's lasting for multiple hours, particularly past the first trimester when morning sickness is typically faded, check your ketones. And some targets here, I'm referencing the milligram per deciliter, but I've got millimoles there. You want to, if you're, these are where you want your ketones to be, generally speaking. So the reason that people who are, say on the keto diet can check their ketones is because there's always some amount of ketones present. But we want that to see that they're below 15 milligrams per deciliter. You'll want to call your provider, be in touch with your provider if you have if you have ketones that are greater than 1.5 millimoles per liter. And I will toss up the, I don't have the milligram per deciliter here, but I'll make sure to throw that up here. But You will almost certainly feel that. We've all had ketones probably, um, whether it was, a long time ago at diagnosis, or when we were sick or something like that. Um, but you're going to have a good internal guide of, how are you feeling and whether or not, the 150 or to 160, if that is a serious issue. But when in doubt, we're checking ketones more frequently in pregnancy. So some stress and glucose correlations here. So chronic stress tends to increase our A1Cs by 0.3 to 0.8% during pregnancy. Sleep deprivation increases insulin resistance. Anxiety disorders are really common. In general, unfortunately, we're at 68% of the general population, but even more common in type 1 diabetes pregnancies, occurring at a rate of 15 to 20%. Depression is also something that we tend to see more commonly for diabetics as a whole, but of course in pregnancy as well. And I mention this because of the corresponding impact on glucose levels. So we want to manage our stress. We want to manage our blood sugars, not only for our well-being, but also because blood sugar is part of our well-being. And this pregnancy certainly is a period of stress on our body at the bare minimum. So some practical protocols. If you're experiencing high blood sugars, if you're experiencing the vomiting, and it's not morning sickness, and it hasn't been a pattern, and you've got high blood sugars that are corresponding, we're going to look at checking our ketones, hydrating as much as possible, and then checking our blood sugars every 15 minutes, switching to injections if we're finding that our blood sugar isn't being responsive to our pump. It could be that you have a cannula issue. It could be, that there's a connection issue on that pump line. There could be, something that the pump itself isn't detecting. But even just moving that site, maybe the site has gotten stressed, and so absorption isn't very good. So it's important to exercise caution if you're administering correction boluses and temporary basal rates. So this would be stacking a correction. And the trouble here is that you might come down too quickly. So I'm probably not the only one who has had a temporary higher basal rate with a high blood sugar, and I'm, correcting. But I think that this goes back to the rage bolusing concept, which thankfully I don't see a lot of that, but I had seen someone, reference it, and I thought, oh my gosh, that's a dangerous concept. And then I realized that can apply even to something as simple as this. We want to be really aware that we're not stacking our correction strategies one on top of another. Because one, we might miss really critical information. Are we sick? Are we getting ill? And we're not seeing that. Is our correction factor, or is our sensitivity factor much too weak, and therefore we need to make a bigger change? So these are opportunities to gain information and insight, even if it's stressful to look at that reading on your CGM, or to check your blood sugar manually and see, okay, I'm high. But hydrate. Personally, what that usually looks like for me is trying to drink, I've got a 24-ounce water bottle. I try to drink like half of it every 10 to 15 minutes if my blood sugar is above what I want it to be. And that's going to, of course, get me going to the bathroom, flushing out ketones that, maybe are present. And I'm checking my blood sugar. But what I'll typically do is I will set an alarm on my phone, set a timer rather, so that I'm not checking too often. So timer for about 15 minutes, maybe. That gives me enough time to see a change, but not so little time that I'm going to stack correction doses on top of each other and end up with a roller coaster of a low blood sugar and then a subsequent rebound later. We want to practice self-restraint in dealing with our low blood sugars and our high blood sugars. Okay. I already talked about this as well, but you can plan for some of the stress management pieces in the same way that you plan for sickness, where if you know that you're going to be um, doing something stressful. Say you work at an office and you lead a meeting, the first Tuesday of the month. And even if you are super confident, you're like totally capable, but it's just kind of more work for you, right? Like it's a higher stress day than your typical day. You could watch for a pattern in that with your blood sugars. And if you're seeing that you're starting to get some anticipatory blood sugar increases before that meeting. And then subsequently, you come down, but you've been correcting for them as a result. Setting a temporary basal that day of 125, 150%. And trialing that might be a good strategy to use in order to curb the impact of stress on your day to day. But okay, so takeaway for this lesson: illness and stress have an amplified effect on your blood sugars during pregnancy, and you're going to monitor your ketones at lower thresholds than you would outside of pregnancy. And you want to be careful when using multiple forms of correction to avoid a roller coaster ride for yourself and for your blood sugars and for your sanity.